This wasn't about healthcare, and the federal government just said so out loud. It wasn't about child protection. It wasn't about rights. Here's the model. Take children who are, in their words, physiologically and medically healthy, and make them dependent on the healthcare system for life. HHS calls it a captive patient model. Why? Their answer, not mine. Twisted political ideology, social pressure, and the most upsetting, greed. Pediatrics is the lowest paid specialty in medicine. A sick kid gets one visit and goes home. A healthy kid on blockers is $16,000 a year. Every year. For decades. That isn't a patient. That's an annuity. So they lied. HHS's words. Providers decided more or less just to lie about what they are doing. They billed healthy children for diseases those children did not have. $47 million in fraudulent billing. Fraudulent. Their word, not mine. And in the states that ban these procedures for minors, the false codes were used to get around the law. Now Colorado. Children's Hospital Colorado, named in the federal appendix. Puberty blockers, billed under unspecified endocrine disorder. No gender diagnosis, no early puberty, just a code that pays. Kaiser Colorado, blockers for 13 to 17-year-olds, billed as precocious puberty, a diagnosis for toddlers. 64 Colorado facilities billed for pediatric gender transition between 2019 and 2023. 64. And our legislature? House Bill 25-1309, signed May of 2025, requires every state-regulated health plan in Colorado to cover gender-affirming care, including surgery. And there is no age floor. Nothing in that law excludes a child. This was never about health and well-being of children. HHS's own words for it: deception, medical malpractice, fraud, stolen innocence. And this is what the war on parental rights actually looks like. Not a debate, a billing code, a coverage mandate, and a parent with no standing to protect their child.